I'm Ewan Macaulay. I'm a consultant vascular surgeon at the Royal Adelaide Hospital. Well, vascular surgery deals with all the blood vessels outside of the heart. The heart is dealt with by cardiac surgeons, and we deal with everything else. And the diseases of the arteries are either narrowing or blockages, what we call arterial disease or atherosclerosis, or they get bigger, in which case we call them aneurysms. And the most common diseases of the veins are obviously deep venous thrombosis, which is usually looked after by hematologists, but for vascular surgeons it's basically varicose veins. Well, arterial disease or atherosclerosis is narrowing or blockages of the blood vessels, and it's developed due to a combination of features, unfortunately, that patients are actually preventable. And it's caused by smoking, diabetes, high blood pressure and high cholesterol. And so these diseases affect the lining of the artery called the endothelium, and this causes narrowing or blockages of the vessels. The other causes of it is enlargement of the vessels called aneurysms, and these often run in families. So vascular surgeons, what we can do is we can open up the blood vessels, and we do that in two ways. One, using keyhole techniques and x-rays. We can use balloons and stents to open up the arteries, or we can do open operations. And those open operations involve cutting down and either cleaning the artery out or cutting down and bypassing the artery. Unfortunately, in vascular surgery, we also do the amputations. So we have to remove toes and feet and legs in patients in whom vascular disease is very severe. No one knows why arterial disease affects the lower limbs rather than the upper limbs primarily. The theory is that gravity may have something to do with it, and that may be related to the way that the chemicals, etc., settle in the body, but no one knows exactly why.